And then doing things with gloves would make it worse.
I'm Hillary Brown, and today I'm going to be
gloves to protect you,
doing
not
a Life Port Access. So the first thing that I'm going to do is check the doctor's order and make sure that there is an order for this today to be done on this patient. So I'm checking the doctor's order. The order has been placed, so the first thing I'm going to do is gather all of my supplies, which is the normal saline, alcohol swabs, two 10 milliliter syringes, two 1822 needles, my Huber needle, and my dressing change tray. So I've got all that. I'm going to wash my hands, go into the patient's room, introduce myself, check two patient identifiers, which is name and date of birth, and I'm going to explain the procedure to him, tell him what's going to be going on today, and tell him I'm pushing meds through his Life Port Access. So the next thing I'm going to do is wash my hands and put on clean gloves. And I am fixing to assess his Life Port site and see if there's any redness, swelling, or edema going on. So I'm looking at his site. There's no redness, no swelling, no edema. Everything looks okay. Taking my gloves off, throwing them away, washing my hands again. And the first thing I'm going to do is go ahead and clean my normal saline. And let that be dry. And I'm going to go ahead and open my sterile dressing change kit. Pull my mask out. Pull my gloves out. Pinching, making sure not to contaminate anything. And I'm going to drop my syringes in. Open. Drop. Putting in the biohazard bag. Getting a needle. Opening it. Dropping, making sure nothing is touching the sides to stay sterile. Coming around, not interfering with the sterile field. Opening. Dropping. Hopefully this wouldn't fall out at any time. Putting in the biohazard bag. So next thing I'm going to do is wash my hands again. Put on my mask. Put my mask on my patient. Ask him to turn his head just so we don't contaminate the field.
Label with date, time, and initials.
Patient's head's turned. The next thing I'm going to do
Change this.
is put on my gloves.
Clean gloves. Come in and take out the old dressing. And then take the sterile. Well, technically clean this side. So
Going to pinch up, step away, put on my gloves,
another off stop.
cuff up under this one, cuff up, put on my glove. Going to use my elbow and pull this off. Alright, next thing I'm going to do is grab my syringe and grab my needle, put together, drop my cap back in there because I'm going to need it, pull up 10 milliliters of air.
I know, I was saying with mine.
Going to pierce into and push the air in,
All you got is the offsite, and the offsite's sealed in piece.
flip up, and start pulling back 10 milliliters.
Because you already got your offsite. Only thing I can think of is making on a video and verbalize it.
Alright, and I pull back a little more than I should so I can push back. And we've got 10 milliliters with no air bubbles. So what I'm going to do is split back down, grab that top that I just needed, and using the cap, put on the rubber only, and pull the needle out. Now I'm going to recap. find this. Pull apart. I can put it back in there, it's still sterile. And I'm going to go ahead and clean for 60 to 90 seconds vigorously. I'm going to clean a big area just in case my syringe were to touch a piece of skin. Go ahead and clean it. I'm going to try not to though. Cleaning up high, all around, with my forehead again. Really make sure to get the life port access site well.
Alright. Mom's good. I know. She can't.
Okay, drop this into the biohazard bag. Next thing I'm going to do is get my Hoover needle out and attach
Get my needle ready.
and get it in my hand. I'm going to go ahead and clamp it
You good?
and pull this off. Next thing I'm going to do is to unclamp, and I'm going to make sure the line is patent into the trash can. Wait a minute, I think it was off. There we go. Okay, line is patent. Okay, so I'm going to clamp again. Make sure you're holding it in the right hand the right way so you don't, nothing touches. And I'm going to use my non-dominant hand, make a U, and tell patient there's going to be a big stick on 3. 1, 2, 3. Push down. Okay, next thing I'm going to do is pull back, get a flashback of blood, and I got a flashback. So I'm going to push the 10 milliliters of normal saline into his life port. Next thing I'm going to do, let go, reach in, get my bio patch, slip it under to make sure this is stable, lock down. The next thing I'm going to do is grab my clear adhesive, my op site, drop in my biohazard bag, and place down over my patient. Making sure all 4 sides are down well. It looks like it's going to.
Can't do that during the video. Alright, so.
There we go. Alright. And I'm going to, since all 4 sides are down, I can clamp and deattach. And I'm going to get another piece of a clear adhesive, stick down, write date, time, and my initials to let people know that I did it. And now I'm attached. What? Cap it. Oh, cap it. Sorry. I'm sorry, I forgot to cap it. And now I'm unsterile, so I can take this mask off, discard, and explain about what I would do if I was going to do a dressing change on this patient. If I was going to do a dressing change, I would gather my supplies, make sure that I needed to do it, gather my supplies, and come into the room, assess the site, take this clear adhesive off and assess the site, make sure there's no redness, swelling, or edema going on, making sure everything looks okay. Take the bio patch off, get your chlorhexidine, wipe down really good, and get as close underneath there as you can to make sure you're getting everything out and clean. And after you've got it well and clean, put another clear adhesive down, date, time, and initials once again, and you're good. And document how you, you document how patient tolerated, how you did it, and document yourself what times and everything you did it. And I think that's it. Thanks.